Molweni kuninonke Nelson Mandela Bay naseMzantsi Afrika jikelele. Goeiemiddag aan almal in Nelson Mandela Bay asook in die hele Suid-Afrika. Assalamu alaikum wa rahmatullahi wa barakatuh. Good afternoon to all the residents of Nelson Mandela Bay and beyond. My name is Princess Tobin Diouf, the Acting Director of Communications, Nelson Mandela Bay Municipality, and I will be your Program Director for this webinar. A warm welcome to the Nelson Mandela Bay COVID-19 Resurgence webinar, where the city is going to share with yourselves, the viewers, all the work that has been going on since the declaration of lockdown regulations on March 2020, as well as since the city of Nelson Mandela Bay was declared a hotspot of the entire country. Today, we are joined by the following panelists. Mr. Shane Brown, the Head of Disaster Management of Nelson Mandela Bay Municipality, and also the Head Convener of the Joint Operations Center in response to the COVID-19 in the city. Welcome to Mr. Brown. We also have Mrs. Sonia Lupondwana, Director of Primary Health Care, Eastern Cape Department of Health, working in the Nelson Mandela Bay District. Welcome to Mrs. Lupondwana. She will join us a bit later. We also have Dr. Patrick Nodwele, Director of Environmental Health Services within Public Health Directorate in the Nelson Mandela Bay Municipality. Welcome, Doc. Last but definitely not least, Mr. Warren Prince, Acting Executive Director of Safety and Security, Nelson Mandela Bay Municipality. Welcome to you, Mr. Prince. So this is how the webinar will unfold. I will introduce each speaker who will do a PowerPoint presentation pertaining to their line of work. All presentations will be allowed to unfold and questions will then be entertained at the end of the session. Each panelist will get an opportunity to answer a maximum of 3 questions. Since the Nelson Mandela Bay Municipality has been declared a hotspot of the entire country, some regulations that were applied to the city were unique in order to increase the efforts to control the spread of the virus. The decision to make Nelson Mandela Bay a hotspot came as a result of the alarming number of infections in the city. The implementation of these unique regulations caused an uproar in some parts, whilst in other parts they caused confusion. The unique regulations include the beach closures as well as the curfew. Let me then introduce to you Mr. Shane Brown to present to us the roles and responsibilities of the Joint Operations Center, and most importantly, what the unique regulations are to help clear some of the confusion and frustration that is out there. Over to you, Mr. Brown.
Good afternoon, everybody. And thank you very much for that warm welcome. I've been introduced, so I'm not going to say who I am now. I think before I actually get into my presentation, just a little bit of a background. I've been involved in disaster management for over 30 years, and most disasters will last maybe a week, maybe 2 weeks maximum. We are sitting with a pandemic disaster that has actually been going on since March. And we've had to operate as in a disaster situation since March this year, which in itself has got an incredibly difficult set of rules and regulations as far as everybody having to be part of this process for such a long period of time. Also, our thoughts go out to all of those who have lost loved ones over this period of time. If we think back to last year's Christmas or festive season, where we went through, the world was kind of normal. We enjoyed ourselves, we went out, we went to the beach, we did a whole lot of things. In fact, up until February this year, that's exactly how life was. Little did we know that in March, our lives would change. Hopefully not forever, but they've changed for 2020. I often refer to 2020 as somewhat of a lost year. We have lost so many things. People have lost their lives. Students have lost a year of the special things that happened at school during this year. People have got sick, people have survived, and we've got to appreciate that as we go forward. We came through a first wave relatively well, and then we had a very quiet period of just over 2 months, and in October we noticed our figures starting to rise once again, which was later acknowledged as a second wave, which had brought in a whole lot of different processes, different concepts. Also, please understand, at the same time, we had people that had been working since March non-stop, and they had to pick themselves up all over again to deal with the second wave of this virus. I think I need to go into my presentation now, but that's basically the background of where we come and what we've had to do over this period of time. If we can move to the next slide. It's basically just the legal framework and context of COVID-19, which leads to the Constitution, the Disaster Management Act, the regulations, National Treasury and MFMA regulations, our Municipal Structures Act, the Municipal Systems Act. Keeping in mind the Disaster Management Act, and I think it's a very important point, makes allowance for 3 kinds of disasters to be declared. The one is a local disaster, where the metro or the municipality manages that disaster more or less on their own. They make their own directives, they make everything on their own. The second type of disaster is a provincial disaster, where more than one municipality has been affected, and that those municipalities cannot do this on their own. So then is declared as a provincial disaster. A national disaster means that there's more than one province affected. Now you will note that this is a national disaster. The directives and regulations that come from a national level. So the municipalities need to implement what comes from national. So it's not the municipality that's issuing the regulations and the directives. Those are from a national level. We need to implement those regulations. If we can go to the next slide. This gives everyone just a slight idea of the enormity of the task. Since 18th March 2020, there have been close on 292 pieces of legislation. That includes regulations, directions, determinations, notices, bills, and other legislation. That is an enormous amount of legislation and directives just on one disaster. And it actually serves to highlight the fact of the enormity of the task at hand. We move to the next slide. Next slide. This is a current situation, well, almost a current situation. So it's roughly 5 days old, or 3 days old now. But you will notice that this current, on the 17th of December, we had 2,058 cases in the metro. Almost the entire metro was covered with COVID in some way or the other, which made the impact even more difficult than the first wave, in that there was literally nowhere you could go. And also in the second wave, one needs to keep in mind we were on a level 1 restriction. The first wave, we were on level 5 and 4, where people were basically confined to their homes. And this is why level 2, the second wave, we had such a huge spread in this, and so quickly in this metro. Can I move to the next slide? The Joint Operations Center, we refer to it as a JOC, and that, as I said earlier, this JOC has been meeting since March 2020. And I've been the chairperson of this JOC, or convener of this JOC, since then. The JOC consists of many various role players throughout the metro, and we're talking about senior people from Disaster Management, Department of Health, Public Health, South African Police, our local Metro Police, Metro Traffic, Metro Security, SANDF, Correctional Services, and it goes all the way down to our communications. And the reason for so many role players is to ensure that we have a joint collaborative effort in trying to curb the spread of COVID-19. To do this, we needed to work together in this process. And the JOC brings people together with all the different areas of expertise, and we can deal with situations in a quick and productive way in dealing with this. We also had to learn certain lessons during the JOC. In the beginning of the JOC, we basically brought everybody together into the JOC in a meeting. However, with COVID-19, it threw another spanner in the works, in that we had to quickly learn how to have virtual meetings in order to proceed and also not put everybody at risk. Next slide. the approach, and this is the approach that we've taken in the second wave. We need to act now to stop a second wave. That's meeting outdoors in a space or in a space with good ventilation. These are just helpful approaches that we've taken to the messages that we needed to get out to the public. And some of these messages have been going out since the beginning. Wash or sanitize your hands regularly. I'm pretty sure we're all pretty tired of hearing that, but it's something that we have to live with probably for a long time still to come. Avoid crowds and gatherings. That's probably been the single biggest issue in terms of spreading COVID, crowds and gatherings, be that funerals, shopping malls, or in places of entertainment. That's where the spread starts. This is why the president said, let's start not isolating ourselves, but we need to stop getting together in groups. As South Africans, it's a very difficult situation in that we like to be with one another. We like to be in groups. We've had to learn how to behave differently, and it's a process. We still need to go through to that process. There's a COVID alert app, which we would suggest to everybody to download that. And it will notify you of areas that are exposed to coronavirus. Keep wearing a mask whenever you are in a public place. I know they're unpleasant to wear, but they have been proven without a shadow of a doubt to reduce the risk of spread of COVID. So wearing a mask is probably one of the single most important things we can do in times of COVID. Maintaining a distance of 1.5 meters from people at all times, difficult. We're a nation of huggers, but that's what we need to do, at least 1.5 meters. If you're planning to travel during the festive season, avoid areas identified as coronavirus hotspots. I know that's a controversial matter, but the fact is we've got to choose life over so many other things, and we need to be careful as we go forward. Keep social gatherings as small as possible and meet family and friends outdoors if possible. If you're using any public transport, make sure the windows remain open at all times and wear a mask. Next slide. Interventions. And these are some of the interventions. The strong communications, no alcohol in public open spaces, wearing of masks, avoiding crowds, meet in open or well-ventilated areas, communicate curfew times in all media with an on-the-half-hour broadcast at night from 8 o'clock to 10 o'clock, keeping in mind that our metro is a hotspot. That means our curfew starts at 10 o'clock and not 11 o'clock, as many people seem to believe. A 10 o'clock curfew means that you need to be at home already. 9 o'clock places need to start closing, that people can be home by 10 o'clock. So the curfew is 10 o'clock. Law enforcement, my colleague will speak more on this process, but law enforcement are there to ensure that the curfew is upheld. Liquor outlets are closed when they are supposed to be closed. Drinking in public is not allowed. Gatherings are reduced to bare minimums in terms of the COVID regulations, and mask wearing. Keeping in mind, again, mask wearing is not a criminal offense, but it is mandatory, and it will and can save your life. So please continue to wear a mask. Next slide. Some challenges as a result of COVID, and I've mentioned some of them along the way. Funerals, gatherings, major events. Those have been proven without a shadow of a doubt to be the catalyst for spreading COVID. Shopping malls. People are not allowed to enter any shopping mall complex without wearing a mask and sanitizing of their hands. But once inside the complex, you will find shoppers not adhering to the wearing of masks. Please keeping it in mind that the owners of those centers, the managers of those centers, can be legally held accountable. It is a criminal offense if they allow people into the mall or center without a mask. So they can be held accountable. Liquor outlets. No social distancing or adherence to any of the Disaster Management Act regulations are adhered to inside taverns, nightclubs, etc. Obviously, when people are inside, they tend to remove their mask. And one of the issues with removing your mask is normally, quite often, is music being played. People get close to one another. Becomes a catalyst for spreading. Patrons inside these premises do not wear masks once inside, and there's no sign of social distancing. We have noticed it as being a huge problem. I brought up wearing of masks. It remains a concern. It's an ongoing concern. We need to, we will keep on reiterating that issue. Wearing of masks is critical in preventing the spread. The rapid spread of the infection rate. Again, we've got good news in our metro. but bad news for the country. The good news in the metro is that our infection rate is actually coming down. Our spread, I said earlier, started in October. We're now mid-December. Our spread rate is reducing, but the country is going up. And being over festive season, people on holiday, it does not mean we must let our guard down now. We need to keep the guard up as we go forward. Next slide. Regulations, and I'm not going to go a lot into the regulations. I've already spoken about curfew time. The curfew times that apply to the metro, movements of persons during the curfew. Remember that during a curfew, it's only people performing essential services, your emergency services, your security, your police, that can be out after curfew. Everybody else needs to remain at home. Closing time of certain establishments, keeping in mind that closing time is 9 o'clock. Curfew is at 10 o'clock. 10 o'clock, you need to be at home. Next slide. Beaches to be closed in the Eastern Cape and Garden Route. I suspect this is probably one of the hardest things for most people to accept. As mentioned earlier, this comes from a national directive. The directive is that we close beaches to all persons except for fishermen who have a valid fishing license. The rest of it, it's a no-go area. We have to enforce it. And people will ask, what is a beach? In terms of the Seashore Act of 21 of 1935, a beach is an unconsolidated sediment forming the vegetated edge of the shoreline. That is from the low level mark to where the grass starts growing. That is your beach area. Gatherings also, public parks are closed in the Eastern Cape and Garden Route. That's all in terms of being a hotspot. And they close from December the 16th until the 3rd of January. Places and premises closed, and nightclubs remain closed. They were never allowed to be opened. Next slide. General, just some of the following offences should be noted. Intentional misrepresentation that a person is infected with COVID-19 is an offence. Failure by a driver or operator of any form of public transport to take reasonable steps to ensure compliance regarding wearing of mask is an offence. Failure by a manager or owner of a building, place, or premises, including a government building, place, or premises, used by the public to obtain goods or services to take reasonable steps to ensure compliance regarding wearing of face mask. Otherwise, they are guilty of an offence. Failure by an employer to provide every employee with a cloth face mask, homemade item, or another appropriate item that covers the nose and mouth when they work in the workplace. Failure by an employer, principal of a school, or owner or manager of an early childhood development center regarding the wearing of a cloth face mask is another offence. We need to keep in mind the wearing of a face mask is essential. Next slide. And that's the end of my presentation. Thank you very much. Sorry, Princess, your mic is muted.
Apologies. Thank you to Mr. Brown for that presentation. And I truly hope that your presentation has shed some light and cleared up some of the misconceptions that are out there regarding the regulations, and also for stressing the importance of following the regulations in order for us to curb the spread of the virus. I'm now going to introduce the next panelist by the name of Dr. Patrick Nodwele, the Environmental Health Director, Nelson Mandela Bay Municipality. Now, the Environmental Health Unit has been very instrumental in doing a lot of community blitzes on the ground, where they would go to shopping centers, go to the queues, ensure people are taught how to wash their hands, taught the importance of wearing a mask, taught the importance of social distancing, because especially when it was in the earlier lockdown levels, people did not understand how important it was to keep a distance from each other. And the environmental health practitioners who report to Dr. Ndwele would actually go physically to those queues and ensure that people stand 1.5 meters apart, because you can't get the COVID if you stand too close to each other. With that, I would like to allow Dr. Ndwele to give us an indication of all the work that they have done as a department in the city.
Thank you so much, Chairperson. Basically, as the Environmental Health Subdirectorate of the municipality, we are the health mandate of local government, which is coming out of the Constitution of the Republic of South Africa, as well as some of the key national legislation, such as the National Health Act. If you can go to the presentation, please. Thank you so much. Move to the next slide. This is basically the context of municipal health services in South Africa. They are a reflection of the health value chain, particularly from the communicable diseases point of view, because before a person gets sick, they must have an interaction with unsafe environment. And it is that unsafe environment that will lead to a person possibly getting sick and needing hospitalization or attention from a healthcare practitioner. So I think what this pandemic has shown in South Africa is the significance of an unbroken health value chain from the local government level all the way to the national government level. Thank you. If you can move on to the next slide. This is a basket of municipal health services, and it basically shows the structure that we use out of this mandate of local government on health services. There are quite a number of areas, focus areas in the municipal health mandate, but those that are highlighted in red out of the mandate were the ones that we particularly selected to respond to COVID-19. They include the health surveillance of premises. I think if you listened carefully to Mr. Brown's presentation, premises refer to the built environment, whether it is premises as in households, office spaces, shopping malls, and so on and so forth. It is basically refers to the health aspects of accommodation. I'm going to go deeper to that in the upcoming slides. And then we also have a mandate on the surveillance of disease as well as the prevention thereof, which is a work stream that we used together with contact tracing to map the progress of the pandemic locally, and as well as to formulate tactics and responses to respond to the pandemic. We also have a mandate on health education and community outreach, because this kind of a pandemic is not a pandemic that can be defeated only in the healthcare institutions. It's a pandemic that should be defeated in the community by allowing the members of the community sufficient knowledge to take care of themselves and to take care of others. We also have a significant area of healthcare waste or hazardous waste. The masks and other equipment that is used by persons who are COVID positive is infectious in nature. It has to be handled particularly well from the point of generation all the way to the point of disposal. So we have to look at that so that we close the gaps on those areas that can cause the pandemic to proliferate. We also have got a responsibility for management of human remains. In other words, the aspects of death. If you look at the issue of death, there are many gatherings that relate to the death. The latest regulations, particularly in the lower lockdown levels, allow for the viewing of the body, for example, in mortuaries. We have to manage those kinds of gatherings relating to the funerals at the church, at the home of the deceased, as well as in cemeteries, so that we ensure that the COVID-19 etiquette is adhered to. The funeral undertakers are practitioners that are licensed by municipal health services. So in that aspect, we are monitoring their performance in terms of the COVID-19 regulations. We also have a responsibility for enforcement where enforcement is necessary, particularly on the regulated communities, the businesses, and so on, to make sure that they are adherent to the COVID-19 regulations. If you can move to the next slide, please. This is in summary the first work stream that relates to the health surveillance of premises. I'm not going to go into detail because I've already done so in the first slide. But what's important to highlight out of this, the way in which we use various premises, whether it's households, whether it's places of work, whether it's institutions, the churches, and so on, premises. It is important that in the use of premises, we adhere to the COVID-19 protocols, and we are monitoring that part. And where there is a need for enforcement, for adherence, we do undertake that kind of enforcement. Thank you. Can move to the next slide. These are some of the activities, the joint operations that we have locally relating to the transport sector, the local businesses, the entertainment areas such as your taverns and nightclubs. We work jointly with other role players within the municipality as well as other government departments. Thank you. We can move on. This is the enforcement area. What's important to highlight here, we are in partnership with the Department of Justice for enforcement purposes. And from our discussions, there was a specific court that was set aside for COVID-19 related matters. Thank you. You can move to the next slide, please. This area forms part of enforcement. When we do contact tracing, and it's important for institutions, for example, like the NICD, the National Laboratory, to take note of this, because we have had practical experiences on contact tracing, particularly from the environmental health point of view. To phone a person and ask them if they can self-quarantine or self-isolate may not yield the desired results, because what do you take into account, for example, to determine whether a person can or cannot self-isolate? So the questions that you are posing telephonically on people are quite complex questions. So that is why, from the environmental health point of view, we send practitioners to these specific households. There are tools that we use which are objective in nature to make sure that when a recommendation for either quarantine or isolation is made, it is based on objective criteria. It's quite important, even when we write the national protocols, to understand that there are those practical aspects when it comes to contact tracing. If you can move to the next slide, please. This is the work stream that I was talking to, that is doing the contact tracing together with our sister departments, for example, the Department of Health. We're partnering in that exercise to make sure that the positive cases as well as their contacts are reached, as well as those who need isolation or quarantine, they receive that kind of service, to make sure that we contain the spread of the COVID-19 virus. If you can move on, please. These are the local daily cases. I think they go up to last week, I think. But as Shane indicated earlier, it's showing a downward trend, as you will see in the next slide. If you can move on, please. There is quite a promising decline in the number of cases. These are monthly cases averaged for the Nelson Mandela Bay area. What's important to note is that when cases are declining, it's not time to lower the guard. We have to keep the guard always, in other words, adhering to the COVID-19 protocols. Thank you so much. You can move on. We have introduced, I think, this area of the environmental health early warning system for COVID-19 to the municipality. We are working with various partners in this area, such as the NICD, the Medical Research Council, to make sure that we are a step ahead to the pandemic, maybe a week, 2 weeks ahead, by ensuring that we test the presence of the virus in the wastewater, because studies have shown that even before a resurgence is showing in the community, we'll be able in advance to pick up the presence of the virus in the wastewater. So we are introducing that system in the Nelson Mandela Bay Municipality with our partners, as I said, the NICD, the municipality, as well as the Medical Research Council. So from January next year, we'll be on a weekly basis running these tests on wastewater, just so that even if the cases decline completely, we will continue with that program, so that we can have early warning signs for any future resurgence, to advise in good time, so that all the necessary services can be put together to manage such a resurgence. Thank you so much. You can move forward. As I indicated earlier, we also have this work stream. It's a very important work stream in our view. There are 3 aspects which I can summarize for this work stream. One is the awareness raising in the community, which in my view is quite very important, because this kind of a pandemic, you need all hands on deck, so to speak, everybody taking individual responsibility. Number 2, there's an area of stakeholder engagement. Engagement with the funeral undertakers, engagement with the businesses, engagement with the churches and other civil society organizations, to make sure that we are basically on the same page as far as responding to COVID-19 is concerned. Thank you. You can move to the next slide. You can move to the next slide. This is a very important area, as I indicated earlier. I'm not going to dwell much on it. The healthcare risk waste that comes out of the COVID-19 COVID-19 cases has to be managed from the point of generation all the way to the point of disposal, and there has to be a proper balance on the volumes generated and the volumes disposed, so that we know that such a waste did not go out of its value chain. What was generated is what is disposed of. So we require accountability on all the healthcare risk waste generators. Thank you. You can move on. These are some of the pictures that show some of the work we do. You can move on. This is quite an important area, the management of human remains area, management of death, in other words. Making sure that the death resulting from COVID-19 is managed from the point of death all the way to the point of disposal of human remains, because there are quite a number of risk areas in the human remains value chain, if I can put it that way. So we are making sure that even from the government facilities, government mortuaries, there is compliance In other words, there's proper storage of bodies, there's proper storage of healthcare risk waste, there's adherence to the temperature requirements for premises, the requirements for the structure and so on, as well as the management systems are there to make sure that the human remains are managed in a way that reduces the risk of spread of the virus. You can move on. This is some of the work that we do both in the, as I indicated, in the public sector as well as in the private sector. You can move on. These are some of the statistics on the work that we have done since March. If you look on the graph, I think July and I think November are quite, we had quite very sharp peaks on the pandemic, the peak one being for the first wave and the second peak being for the second wave. I think we are managing quite well because we are seeing now the decline in the number of cases. Move on, please. This basically, I think this has been on this area has been on the news quite a lot. The availability, in other words, the capacity of the body storage space within the municipality, and somehow there were quite inaccurate reports out there that things were out of control. We were not managing. We want to set the record straight that we're very much in control. We know how much space we have. We take stock of the number of beds, the available space. So this is the pie charts show the week before last, and then the one at the bottom shows last week. The red part is the red part shows the space that is utilized. The gray part showing the space that is available. As you can see, as the number of cases are declining, even the body storage capacity is increasing as well. You can move on. This is the capacity of our cemeteries. The blue column represents our cemeteries, and the green, the second column, is the available burial space. We would not wish to utilize the available burial space, but we are just showcasing that as a municipality, there is a sufficient capacity. We have planned for the worst. In other words, there is more than 80,000 available burial sites within the municipal area, and also there are investigations for new cemeteries to be developed in the near future. Thank you so much. You can move on. This is the cremation capacity of the municipality. There are 2 crematoria, authorized crematoria in the municipal area. And jointly, should communities opt to go for that route, we've got a cremation capacity of 900 cremations per month. So the issue of things being out of control when it comes to management of human remains really wasn't so accurate when it was portrayed on the news. Thank you. You can move on. From the municipal health point of view, this slide just shows what we need to manage COVID-19 from the municipal health point of view on a monthly basis. These are our logistical requirements and the cost implications. You can move on. Thank you. I think that's it. Thank you so much, Chairperson.
Thank you very much, Doc, for that very informative presentation. I'm sure that has shed a lot of light. Wool has been removed from the eyes of many today, as many people do not realize the intricacies that are involved in the work that your department is delivering in the city. Thank you very much for that. I will now introduce Mr. Warren Prince, the Acting Executive Director of Safety and Security. Safety and Security is a directorate that is responsible for law enforcement. And law enforcement is also one of the pillars or one of the arms that is key in the fight of coronavirus in the city. I know from a communications point of view, there are views that the law enforcement is not happening or it is not enough. So I think the presentation of Mr. Prince would shed some light as to all the work that is being done, not only by the municipality, but all the agencies that work together in enforcing the law of the city. With that, I'd like to hand over to Mr. Warren Prince.
Good afternoon. I've been already introduced. From my side, I just want to say that the COVID-19 created social upheaval and altered norms for all members of society. But its effect on first responders have been particularly profound. Law enforcement officers have been expected to coordinate local shutdown, encourage social distancing, and enforce various regulations as been promulgated on the 15th of December 2020 by our president. We can go over to our slides. This presentation is basically to indicate what are we currently doing and what regulations we are busy enforcing. Next. The enforcement officers in terms of the disaster regulations. The undermentioned departments are regarded as enforcement officers in relation to the Disaster Management Act. The agencies, traffic and licensing services, which are all peace officers in this department, our Metro Police, all operational staff, security services, that is peace officers in the department, and other law enforcement agencies, in particular SAPs. In terms of the definition of an enforcement officer, it's been stated that an enforcement officer includes a member of the South African Police Service, the South African National Defence Force, Metro Police, traffic officers, immigration inspectors, and a peace officer as defined in Section 1 of the Criminal Procedure Act of 51 of 1977. Next. The Nelson Mandela Bay Municipality has been declared a hotspot area in the Government Gazette promulgated on the 3rd of December 2020. The declaration of the Nelson Mandela Bay Municipality as a hotspot did bring the following specific offences into effect, and that is to curb and see how we can manage the COVID-19 spread. In terms of the updated regulations dated 15 December 2020, offences were created, offences and penalties, in which Regulation 87 has been defined as follows. For the purpose of this chapter, any person who fails to comply with or contravenes a provision of Regulations 82, 84, 12E, 85, 1 and 2 and 3, Section 86, 1 and 3 of these regulations commits an offence and is on conviction liable to a fine or imprisonment for a period not exceeding 6 months, or to be both such fine and imprisonment. Regulation, it must be noted that the above offences are criminalized and that the contravention thereof will lead to criminal sanctions being leveled against the offender. The following should be noted. Next. Offences and penalties in terms of Regulation 87. For the purpose of this chapter, any person who fails to comply with or contravenes a provision of or regulations. Section 82, curfew between 2200 and 0400. 84.12E, where a bulk of people have a problem with. Gatherings at beaches are allowed subject to the following exceptions in terms of E, festivals, live music, live performances, and loud music at beaches are prohibited. 85.1 and 2, dealing with the prohibitions of initiations practices. 86.1 and 3 deals with the sale of dispensing of liquor, which may only be sold from Monday to Thursday between 10 in the morning and 1800 in the afternoon. Next, actions that are taken to stop the spread are but not limited to the following. The law enforcement through proactive and reactive steps. The proactive steps that we are currently taking is warnings, loud hailing, precautionary visits to hotspot areas like clinics, testing sites, malls, post offices, sanctioned events, businesses, etc. Reactive steps are arrests, dispersal of crowds, and issuing of fines. These law enforcement steps are made possible through visible patrols, vehicles and foot, and also roadblocks and VCPs, which is vehicle checkpoints, attending of complaints initiated through the SUBS control room or emergency control room, and coordinated response protocols through the JOC. Next. The joint operations executed are a big part of the coordinated response. These joint operations are conducted between all relevant role players and are aimed at stopping the spread of the virus. Recent joint operations had the following aims: creating awareness of the new regulations, tavern compliance, operational awareness of the transport industry with regards to the responsibility of wearing a mask, and the creation of awareness at liquor outlets and places of worship. Next. And hereby I thank you.
Thank you, Mr. Prince. I'm sure many people will have questions of clarity, but we'll field those questions at the end. Mrs. Sonia Lupondwana is our upcoming panelist. She comes from the Eastern Cape Department of Health, and she is the Director of Primary Health Care. As you all know, that with the upsurge of the numbers in the city, the Department of Health was responsible for launching the mobile testing in the Nelson Mandela Bay. They would go out with mobile trucks and they would test residents, and this service was provided for free. They also, in connection with the Environmental Health Department, did contact tracing, and they would do personal visits after tests, after people have tested positive, to check what the home environment is, etc., etc. And they've also been very instrumental in providing the city with up-to-date stats in terms of the amount of people that are affected per ward or per area, the amount of deaths, recoveries, etc., etc. With that, I would like to give the opportunity to Mrs. Lupondwana to give her presentation. Over to you, ma'am.
Thank you, Princess. As you've mentioned, I'm from the Department of Health in the Nelson Mandela District, dealing with primary health care. The area that I'll be reporting on or giving an update on will be on community activities that we did in order to mitigate the rising numbers of the COVID. Can you please kindly host the presentation? Thank you. Next. If anything that I will urge as real citizens to remember from this presentation is the visual picture of what we have in front of us, the spread of the COVID. And if you look at the spread of it, it covers almost the whole of the metro. And if you focus on the blue dot, you'll find that those cases are cases up to 2,000 in that specific area. If nothing else from this is to demonstrate that COVID is real. And we need to strengthen compliance to our prevention measures. Next. The presentation covers an angle where, as the Department of Health, we follow the World Health Organization recommendation on how to respond to COVID, as well as in terms of how to assess yourself in terms of readiness for you to come up out of the lockdown. And the World Health Organization recommends that the first of all, in order for you to come out of lockdown, one, you must have controlled your transmissions. Your transmissions must have been in control. You would have improved your capacities to test, to isolate, to trace, and to quarantine. You would have minimized the outbreak in special settings, like your health facilities, your old age homes. You would have make sure that in the workplace, there are preventative measures. You would have made sure that the risk in importation has been reduced. And lastly, you would have ensured that your community is well educated. Once those 6 criteria are met, then that is an environment that is best then for you to, as the country or as a district, to come out of lockdown. Next. If we were to look at the progress and the activities that we've done so far in terms of trying to respond to controlling the transmission, next, you'll find that the COVID itself, maybe we need to look at the overall picture, although the presentation is focusing on the activities we did in the second wave. But I wanted with this slide for us to have a full picture in terms of where we are with the COVID and where we come from. You will remember that from March to about June, it was the time when the COVID was being discovered. We had what we call primary generation of people that were infected. Those are coming from abroad, coming from a certain area that brought it into the district. And then that was the time when then the country went to lockdown, the level 5 lockdown. The infections were controlled at that time because there was restricted or limited movement. But we all know that's not a realistic way to control an infection. We can't keep people locked for a long time. Then that was when we moved then to level 4. But you'll find in level 4, there was a spike of infections. That continued up to level 3. Mostly it was because people were not adhering to the regulations that were set out, and they were not in terms of social distancing, in terms of prevention measures. The spike continued up until we were in roundabout August, when we suddenly saw a sharp decline of infections. If you look at what was happening during that time, there were 2 things. There was one thing where we were, I think it was on the newspapers, where we were trying to strengthen our testing capacities. That is number 1. Number 2, it could have also been from the communities. People are starting to realize that COVID is real. But then we experienced a second surge sometime from September, October, where you can see on the graph, the numbers are spiking very high. There were measures that we did, which forms part of my presentation, in order to mitigate or in order to respond to the spike. And you'll see now, I don't want to say the curve has flattened at the moment. I will say we got a relief. We are in a state of relief. It means people should not relax, because it doesn't mean that the numbers will not shoot again, because the virus in itself for now, it is still erratic in terms of the infection rate. The next one. Next, please. The second one, it gives, can you go back to the previous one? Yes, thank you. This one graph, it zooms in on the second wave, which is the basis of our presentation. If you look at the blue, you'll find that's a pattern of our infections. They started out from small numbers sometime in October, September, and then we experienced a spike in November towards beginning of December, and suddenly the numbers now are giving us the relief. The implication of that is that we'll have what we call a moving average. It means because the numbers are very erratic, you will not have a consistent average. It is moving, trying to adapt to the curve. Next. If you look at the 3 slides in front of me, that is the picture that we have in our sub-district. Sub-district A, which is your Ibai and Motherwell. Sub-district B, which is your dispatch Utnik area. Sub-district C, which is the northern areas and the surrounding suburbs and towns. You'll find that the curve is more or less, represents the curve of the district we saw on the previous slide, but with the small differences. For example, if you notice, for example, in sub-district A and C, you can see that the numbers went up more or less the same time. They peaked at the same time. But the difference between A and C is that A now, the numbers has given us relief. But in sub-district C, the numbers are still high and erratic. It is hence sub-district C is one of our hotspots. Now, if you look at sub-district B, you'll find that it is slightly different in the curve than the other ones, because in sub-district B, there was a delay in terms of the spike of numbers, and as a delay also in terms of the numbers giving us a relief. Mind you, I said I keep expressing the relief part. It's not a decline, because we can only see it over time. For now, I will say it's a relief. Next. The next slide that we are seeing in front of us, it gives us a cumulative number of infections that we have so far. You'll see the latest one, which is the last bar. We have numbers that we have now is 50,280 as of the 19th. And then from that, you can see the line that cuts across the bars. It is the number of infections that we're having on a daily basis. You can still see there the numbers are very erratic, because you'll see there around about the 13th and the 14th, the numbers went down and suddenly peaked on the 15th. And again, so hence we keep emphasizing this is a relief. We have not established a stable pattern in order for us to say the numbers are down. Next. Next slide, please. If we have to zoom in into the wards, so that we can see which wards are influencing the overall picture of concern in the Nelson Mandela, you will find that Ward 7 at 122 numbers in the last 7 days, Ward 37 at 106, Ward 51 at 101, and then we have Ward 10 at 97, and so on and so on. But the most concerning ones will be obviously the ones above 100. It doesn't mean the other ones are not a concern, but in terms of planning, one would like to focus on the areas that are contributing the most, or the drivers of the infections. Next. Next slide, please. If we have to follow these infections to find out which areas where we are having a lot of concern, your Gavendale, Bethersdorp is one of the top, which is in sub-district C. And then we have Rosedale, which is in sub-district B. And then we have Woma, again in sub-district C. And then we have KwaZakele, sub-district A, KwaNobuhle, sub-district B, and Zwide in sub-district A. Those are our those are our drivers in terms of the infections at this moment. But we'll also keep in mind the infection is very erratic. So you might find this week, these are the drivers. Next week, these are not the drivers. Next. In order for us to mitigate these infections, there are a number of activities that we did in the community, especially during the second wave. The first one we did a lot of population-based screening and health education, focusing on the densely populated areas. I'm sure you must have seen a number of us in your malls. You've seen us in our service points like your post office. You've seen us in a number of other areas where we were educating and screening. The picture you can see in front of us, that demonstrate. If you look at the middle picture, you see the queue of people that were waiting to be screened. And then this other thing strategy we did population-based testing, where we identified, can you go to the next slide, please? We did a community-based population screening. We identified our hotspot based on the graph that I showed you before to say, yes, our hotspot. And based on that, we communicated it. Thank you very much to the municipality. We communicate with the municipality and we plan and we go and do testing in those areas. And I'm sure you have seen the NHLS track. This we've done in collaboration with the NHLS. We've done in collaboration with the SACP that provided a security. We've done with the municipality as well. And the other thing we did next slide, please. The other thing we did a lot of robust communication where we explored a number of communication platforms. There was a bus that went around that is still going around that has some technologies where there's a video playing where health education is being delivered. We also used a lot of platforms like your social media through the municipality. We use your Twitters. We use print media where we went to hoist posters in different densely populated areas. We had full soldiers from Right to Care and the municipality that went around and educated people. We were using branding like your posters or your stickers in the cars. We were also going to some with the municipality's assistance to some old age homes as well to provide health education. The district as well has got a call center that we also use as a platform where people can call in and ask questions. Next slide, please. And we had a number of collaborations that we did. As the department, we didn't do it alone. For example, there were a number of foot soldiers that were going around. These foot soldiers were from Right to Care. We also had Care Ministry foot soldiers, a number of NGOs other than Right to Care as well that assisted. You will see them in the malls and probably even in the new year, they go around providing health education. So that collaboration worked very well with us. Right to Care also provided us with assistance in terms of communication, other communication strategies that we can use. Next. Another collaboration that we had was UNICEF. There was a bus that was introduced to communities using a motorcade where there was a lot of education that was done to communities. And in that, we're able to reach a number of citizens with prevention messages. Next. And also, not to forget our sister government institutions, we had a number of integrated planning sessions with a number of other departments, your Department of Labor, SACP, Public Health, and a number of others that I haven't mentioned. And also in that, there were a number of initiatives that we planned, and there was a lot of assistance that we got. As I mentioned, the issues of security from the SACP and many others. And we thank all the stakeholders that participated in assisting us. Next slide. The limitations that we have, of course, in reducing the transmission. The first one is apathy amongst our residents. Our residents do not comply to precaution measures. You'll find them not having masks. You'll find them consolidated or gatherings in big groups. You'll find them in taverns that are densely populated. You'll find them in beaches before the beaches were closed. So we do experience a lot of challenges there in that it limits us from controlling the transmission. The second part of the limitation is the business sector. The business sector is the center of convergence for COVID. Now, if you go to these malls, some of the businesses, you find there are no compliance on screening of employees or even patrons. As a result, these places are places where this COVID can be easily transmitted. It is for that reason we urge our businesses, each and every one of them, to play its part. Ensure you screen your employees, ensure you screen your patrons as they enter your business. Another issue was high crime rate. We'll find that some of our outreach staff, they experience a lot of incidences of crime. As a result, they are not able to carry on at times with the work at hand. At times, they've got to wait for the SACP, which sometimes has limited resources because it wasn't designed to be present in each and every of our teams. So as a result, we do experience a lot of challenges with crime. We urge our communities in the time when now there is COVID, they need to work with us to make sure that we reach the people that we need to reach in order to provide the services we need. We've mentioned the issues of social gathering. Next slide, please. And the second part that the World Health Organization expects us to have under control is we need to improve our health system capacities to test, isolate, trace, as well as treat every contact. Next slide. If you look at the slide in front of us, it gives us an indication in terms of the tests that were done from the 16th of September until December 2020, week by week. The grand total is 74,957, with 17,164 positive cases. You will notice, comparatively to the time when we mentioned earlier in our presentation, that there was limitations in terms of testing because the virus was new. There was a lot of areas that we needed to improve in order to respond in terms of estimations, in terms of how the virus is going to spread. You'll find that now in our interventions with the second wave, there's a lot of work done in order to improve our testing capacities, and the numbers are demonstrating that. The next slide. In the next slide, if you remember, if a person is positive, one expects that Sonia, on an average, stays with the husband and 3 children. That's an average household, meaning that Sonia will have 4 or 5 contacts. If Sonia is single, she will have 4 contacts. So an average, more or less, you expect one index, in this case, is a person that's positive, to at least have 4 to 5 contacts. So meaning when we trace and track contacts, we expect, for example, if we had 5, we would have tracked 5 times 4 or 5 times 5. The numbers, as you can see here, the people that we've tracked are actually lesser than the people that are infected. There are many limitations to that. The first one will be our clients at times give wrong addresses. So when our teams get there, they are not able to get these contacts. At times, because of stigma, they refuse our teams to come in. At times, also because of high crime rate, our teams are not able to reach them. And there are many other reasons. As a result of that, we are looking at other strategies we can use in order maybe to apply the principle that says, if Mohammed can't come to the mountain must come to Mohammed, type of a thing, where we introduce hubs that will assist us so that communities can come, the index cases can come in a walking distance, geographic spread, to come to testing, to hubs that will be there for testing and tracing of contacts. In that, we are hoping to curb the stigma. In that, we are hoping to neutralize any limitations we might have on our side in terms of human and non-human resources. As you can see, the numbers are climbing. So it will put strain on our workforce. Hence, we are looking at other alternatives then to mitigate that. The next one. Contact tracing will be will represent the similar pattern to the contact tracking. Still the same problem, because you have to track a person, trace a person. So it means the same 4 to 5 people. Same story again. We urge our citizens, when they go for testing, you must give your true contact details. We urge our citizens again to assist us with the crime so that our teams can reach the communities that need to be reached. We also urge our citizens to continue to practice social distancing and all the other prevention measures so that we have numbers that are manageable. Next slide. If you look at the total number of cases and you want to see which age group is more affected, it doesn't mean that the other age groups are not. I mean, we are seeing now an increasing number of young people that are infected, but you'll find that age 25 to age 60 are still the ages where infections are very high. And if you look at these people in terms of their description or characteristics, you'll find that these people are working people. It means then that we go back to the businesses, the importance of businesses in order to come to the party. If you are age 25 and age 60 and you are the ones that are infected the most, it means businesses are a critical partner for us to fight the infections. Businesses must start to take a responsibility in their own businesses and for patrons that are coming in, including the staff as well. And then obviously the number of deaths, whilst 25 and 30 and 60 are the ages where infections are high, you will find from the age of 55 up until the age of 75 is where the deaths are high. What that means is that although the 25 and 60, you are more likely to be infected, but from 55 to 70, when you are infected, you are more likely not to survive the infection. Then it means, again, we need to protect our vulnerable older group. The vulnerable older groups that stay with children at home, that stay with us in our families, we have to make sure these people are protected. Let us be safe for them, and let us make sure we engage with them responsibly, because we can get it between those ages of 25 to 60, but we have higher chances of surviving it. But now them from 55 to 70, once they get it, the chances are quite slim that they will survive it. Now, when you look at recoveries again, recoveries tell the same story. It's the same age group, 25 to 60. What it means is that these people of 25 to 60 that are working class, they are more likely to get it, they are more likely to survive it. But then the group that's less likely to get it, which is the older group, is the one that is less likely to survive it. This doesn't take into account the fact that we have a variant at the moment, and there's research that's being done on it. And as a result, until we get full details of the variant, we will be able then to give a better clarity in terms of looking at the impact of it in the picture, where we're looking at infections and the deaths as well. We have a huge number of recoveries. So what it means is that while we are not fortunate in terms of controlling the rate in which we get infected, but the people in Nelson Mandela, again, there's a high level of recovery amongst them in the communities, because as you know, most of people nowadays, they opt to self-isolate at home, they self-quarantine, although we do not encourage that. We even urge our citizens, when you take that decision, take it with your health worker or your public health practitioner, where they assist you to assess your home, so that we can see, in you quarantining at home, are you not going to pose danger to other people? Because sometimes we take these decisions carelessly to say, I'm going to quarantine at home, but then you put other people in danger. Next slide, please. And if we look at the deaths per sub-district, you will find that whilst we are having high numbers, for example, in sub-district C, but in sub-district C, you'll find that the recoveries is equally very high. And you might find that in sub-district A, for example, although the numbers are not as high as C, but the recoveries are much more lesser. So it's sometimes not about only the infection. Sometimes it's about how you manage the infection so that it doesn't lead to end of life. Mostly, our females are the ones that are affected the most. 57.6% of our females are affected, and then the others is 42.1. Next slide, please. If we look at the bar graph showing the, we want to follow up in terms of if now people demised to COVID, those that do demise, which is a small amount, what is the common conditions under which they demise under? You will find that a lot of people with hypertension have shown that they are affected by the COVID and they demise. Diabetes also. So in essence, people with comorbidities, like your asthma, your diabetes, high cholesterol and HIV, they need to take extra care because their immunity is already compromised. That is why it is important people to continue to practice and save a life. Make a change to save a life. Next slide. If we look at limitations in terms of what limitations are we having in terms of testing, isolation, tracing, and quarantine, the first one, obviously, are systematic ones, where there is a time lag, a lapse or time lag between the time a person knows about it and up until the time the tracer teams knows about it. This, it's reflected by a number of people that are going to facilities and saying that I got an SMS and I'm COVID positive, whilst the tracer team hasn't reached you. The tracer team has not reached you because it takes them 2 days before they know that so-and-so needs to be traced. But our facilities are there for those circumstances. We are hoping the upcoming hubs that we want to establish will address that as well. Obviously, because of the high number of COVID in our district, you will have your human and non-human resource limitations because of the high demand. Also, another thing is we are also affected by the fact that our people are providing wrong addresses, as I've said, the high crime rate, as I've said before, and that also creates a bit of limitations on how we trace, we isolate and quarantine people. Lastly, also late presentation. People stay at home whilst they're experiencing symptoms. They don't tell anyone. They're worried about the stigma. By the time they present, already they've complicated. Next slide. The World Organization as well detects that we must minimize the outbreak risk in special settings like health facilities and the nurses' homes. Next slide, please. If you look at our health facilities, we are currently on a drive where we are doing risk assessments, ongoing risk assessments, where we are assessing the capacities for us to provide health services in the midst of COVID. Also, we're developing quality improvement plans based on those risks that we're identifying. As you can see in the picture, we are visiting with the municipality a number of all age homes where we are giving health education as well. As in the previous slide, with the high number of cases, resources, both human and non-human, are going to be strained. Hence, we urge people to assist us to help them. Next slide, please. Lastly, also, the World Health Organization detects that there must be preventative measures that are in place in the workplace, in schools, and other essential services points. You will see that we have been doing a lot. Next slide, please. You will see we have done a lot of groundwork of late, especially in the second wave, sometime in November, late November up until now, where we've been visiting the malls. We've been very visible in our malls, especially we're focusing initially in sub-district A, but we've soon now moved to other sub-districts. We have been very, very vigilant in making sure that we go to these workplaces with the partnership of Public Health and Department of Labor. These workplaces, retailers, banks, and so on, there's an assessment that is done in these places, and recommendations are done to try and make sure that businesses comply to the prevention measures of COVID. Next slide, please. In collaboration with the Department of Labor, there were about 46 businesses that we visited in this second wave. From that, 17 businesses were found to be in contravention of the COVID prevention measures. And as a result, there were some violation notices that were issued, and businesses were given timeframes to do corrective measures. And in that, we're hoping that when the Department of Labor full soldiers come back, there will be a difference. And some violations we picked up when we did this was, for example, lack of screening, basic things. People are coming into businesses, including employees. Employees are not screened. They come in and out, they mix with each other, not screened. We also found that even the sanitizers that are being used are not compliant. As we know, sanitizers must be 70% alcohol. We found that not to be in some cases. At some cases, we even found that they were not even sanitizers at all. There was a lack of employee education, no social distancing amongst employees and even amongst patrons. There was no queue marshal in these facilities that we visited, and even COVID infection themselves are not reported. And there was even lack of a physical barrier between the staff and the customers. Next. Next slide, please. Next slide, please. Hello. Next slide, please. The last one. Okay, it's fine. So in summary, we have done a lot of groundwork, but what we need now is to try and get the communities to understand this is a partnership. We can't do this alone, even if we wanted to. We've got to get people to understand they have to make a change to save a life. Any small change you make, if you make a change enough to prevent yourself from being infected today, you saved a number of people. You save, in essence, a minimum of 4 to 5 people, because those are the people you stay with in your home. Thank you very much.
Thank you very much, ma'am, for that very informative, very long, but very informative. I'm sure many people, they understand in more detail now the work that the Department of Health is doing, working together with other stakeholders. It is not an easy task to be doing what all the officials are doing on the ground, to be controlling the city, to manage people's behaviors, to educate, to constantly, and do this constantly over a period of time. It must be very draining. So as much as it is a challenge for the residents to keep to the regulations, we also now understand the challenges that are faced by the officials who have been given the responsibility to enforce these regulations. Now I think it's time for the questions. We are now going to do the questions. Okay. The first question I will take is coming from Yonker Furi, and I think that one I will pose it to Mr. Shane Brown. Is there any clarity on the issue of the nature reserves and hiking trails in the Nelson Mandela Bay as yet?
Shall I respond now?
Yes.
Okay. Unfortunately, the regulations are fairly clear as far as this goes. Unless the regulations are amended, hiking trails and parks are closed in terms of municipal parks and municipal hiking trails. Where there's access control, such as your Addo Park, Boviance, those parks are currently still open. But so this would require an amendment of the national regulations. So unfortunately, they're still closed.
Thank you, Mr. Brown. I will take the other questions. And this one is posed to Mrs. Sonia Lupondwana from Department of Health. There is a belief that people going to the field hospital in Neve Township do not make it back alive. Because of that, people fear being admitted to that hospital and sometimes delay until it is too late. Please, can you clarify this?
I think we are dealing with perceptions, and it's one of those things that is very difficult to respond to, but I will try. Remember, even the people that are at home, they are being guided by our teams, meaning the same capacity you get here at home is the same capacity you will get at the field hospital. And in the field hospital, there are staff members that are there 24/7. Mind you, we can't run away from the fact that this COVID is very aggressive. I mean, we heard about this new strain now. I mean, this variant now. So it is an aggressive process, I mean, COVID. So we are met with two things of people presenting late for quarantine because of the very fears. So by the time they get there already, they're complicated. And the second thing we are presented with is the nature of the virus itself, that being aggressive. So as a result of that, it's not about the field hospital. It's about the aggressiveness of the infection and the late presentation because of the fears.
Okay. Thank you so much for that. And one more question for Mrs. Lupondwana. This question is coming from Lynn Daniel Stalls. She's asking, are the numbers declining because less people are being infected, or are our numbers declining because less people are going for tests?
We found a good response in terms of people wanting to test. I mean, we've also shown the numbers that were very high comparatively to the first wave. So people definitely are coming to test. Even when we go around, we notice at times we have to ask people to come in the next spot because people are coming to test. So in the numbers in terms of declining, the numbers, as I said, if you notice in my presentation, I kept stressing on the fact that this is the relief, guys. We don't want to relax and look at it as a decline in the curve. We have seen in one of the slides, I've shown the erratic nature of this infection. We could be down today, we could be up tomorrow, depending on how people respond. It's one of the things that got us into this trouble, because when people saw the numbers coming down, they started to relax, and then infection started to spread. So the numbers are declining, but we can only comment in terms of what the implication of that decline in the curve is over maybe a reasonable amount of time.
Okay. And then the last question for you, ma'am. Where can they find out where testing is done?
People must go to the Nelson Mandela Facebook and the Twitter. We always communicate there our hotspots. We communicate the days for testing as well as the spots for testing.
Okay. The next one is relating to safety and security. This question is for Mr. Prince. It has been established that some of the nightclubs or the taverns are repeat offenders. So the question to you is, those that are repeat offenders, will they be shut down anytime soon?
Yes, Princess, there was two questions. There was one on the screen also. Let me answer both simultaneously. The first one that you've referred to is yes. We're looking at that. Last night was an exercise that I was personally involved in. And definitely we need to expect to see whether we can close down these habitual offenders. The second question on the screen was referring to will Metro Police also look at taverns in the townships that's not compliant. Currently, they do. Like I said, last night we visited about 4 taverns, and of which 2 was operational, and the other 2 was closed already. So checks are being done by Metro Police in the areas of the townships.
Thank you so much. It seems like there are no questions for Dr. Nodwele. Okay. I'm just checking if there are any other questions from the team. There's a question, are taverns and shebeens allowed to be open from Friday to Sunday?
Princess, taverns, they are basically, they're not allowed to. They also in the gazetted time frames. So there's compliance in terms of taverns. And the basic is the people is crowding there. And that is the things that we don't want.
Mm-hmm. Mm-hmm. And I would like for Mr. Brown to emphasize again the issue of the curfew. What is the curfew for Nelson Mandela Bay?
It's just to, the curfew is 10 o'clock. That means places need to close at 9 o'clock. As far as places of entertainment over a weekend, they're allowed to be open until 9 o'clock. They can sell alcohol for on-site consumption only. There are no takeaways allowed. So if you want to have a beer, you've got to have it there. And obviously the issue is with the taverns and other places of entertainment, they must maintain the restrictions in terms of the regulations, in terms of the number of people that may be inside the tavern or place of entertainment at any one time, which is 50% of capacity to a maximum of 150, and that's it. So if your capacity exceeds that, you're also breaking the regulation.
Okay. I see there's no, okay. Where can one report taverns that are not compliant? That one is coming from Betty.
Betty, you can report it to the control room of the Nelson Mandela Bay, or you can report it directly to SAPS, to their control room, 10111.
Okay. I'm just checking if there are further questions. Okay. If there are no further questions, I'd like to give a quick thank you to all the panelists that have been present today. Thank you for your time. Thank you for sharing your expertise and the knowledge. And thank you for helping to keep the residents informed. And thank you for the sacrifices that you're making in curbing the spread of the coronavirus in Nelson Mandela Bay. We would like to emphasize the point to all the residents of the Bay and also countrywide that you need to keep wearing your mask, especially when you are out in the public places. Wash your hands regularly. Sanitize your hands when you are out in public places. Keep social distancing, avoid crowded spaces. And this is a very difficult situation for everyone to be in. It has been a long time since March 2020, but I do believe that if we all work together and do the little bit that we can, comply with regulations, we will get to zero infection rate in Nelson Mandela Bay. And with that, I would like to say, let us all make a change to save a life. Thank you very much for tuning in. Keep following our social media pages, Nelson Mandela Bay Municipality on Facebook, also on Twitter. We also have a YouTube page that you can follow. Also, we have a LinkedIn page. Thank you very much and God bless.
Thank you.
Thank you.
Thank you.